of Shaw Cable Systems. The program is presented in response to CRTC policy guidelines regulating community programming.
Ron MacIsaac here, and my first guest is Louise Maclaren, who is a victim of bipolarism and is going to give us a talk on that. What is it, Louise?
Bipolar is a biochemical imbalance affecting the neurotransmitters in the brain, the chemicals in the brain. It's a neurological brain disorder, so it's definitely an illness rather than what some people think as just a flaw in character or whatever. It's
How old were you when you knew you had it?
35.
And what's your occupation?
My occupation was nursing at the time. I'm retired from nursing.
Mm-hmm. And are you retired because you suffered from bipolar?
Yeah, I was doing well after being diagnosed. I was able to go back and get an additional 2 years of nursing training to become a nurse practitioner, and I was hired to work in isolated areas of BC, but I was under the care of a Dr. Abram Hoffer, and the Nursing Association said that if I wanted to go back, I would have to get conventional treatment because his treatment was controversial, using
What was it that worked for you?
well, it definitely worked for me. His treatment, which
Offers?
yes, which was megavitamins and an elimination diet, and I was able to I was stable for a period of time and able to take on a challenging position as an outpost nurse. But the stress of dealing with the Registered Nurses Association, because there is really a negative stigma associated with bipolar disorder and all types of mental illness. And I had been, when I was sick, I was exhibiting some very severe symptoms of depression and suicidal, and my professional association was aware of that. So even though I was able to be stabilized on some medication and the orthomolecular treatment of Dr. Abram Hoffer, the stress of dealing with the Registered Nurses Association was too much for me.
It sounds to me like the greater part of the effect on you is depression rather than the elation.
Yes, for me it's depression, but for some people with manic depressive illness, bipolar disorder, they get more manic episodes, and that's called bipolar 1. Bipolar 2 is when you have more depressive episodes.
Well, other than yourself, everyone I've known that was bipolar were mostly high and acting extremely jumpy and very, very creative during that period, by the way.
Yeah.
Some of the most famous painters in the world were bipolar.
That's correct. I know a number of people with bipolar who are very artistically gifted. They're very creative, and when they get into the hypomanic state, that is just a smaller dose of mania, because once they get to be manic, they can be irritable and really psychotic and not doing well. But when they're in the hypomanic state is when a lot of people with bipolar can be not even recognized as being sick. They're very, very quick, they're very amusing, creative, productive in the hypomanic state. But once it escalates to mania, they can be really irritable and psychotic, grandiose, hearing voices.
How did you assess Margaret Trudeau, who was very outspoken about her bipolar condition?
I'm not sure whether Margaret Trudeau is bipolar 1 or bipolar 2. I have read some things about Margaret, and I've heard right now she's really an advocate for for the mentally ill. She does a lot of public speaking. But she definitely had some episodes when she was younger of mania, when she was exhibiting behavior that was inappropriate for the wife of a prime minister. But she's also had some severe depressions, and I'm not sure whether they were all clinical or situational, like when she lost her son in an avalanche. She became very, very depressed and even suicidal. So,
well, all across the board, what would be a list of the recommendations you would make to people who are bipolar, who have friends who are bipolar?
well, what I'd like to see happen is I'd like the stigma of mental illness to be reduced, and because it is diagnosed in late adolescence, early 20s, and the young people who are being diagnosed with mental illness at that time are already under a lot of stress, either going to university or just completing high school, and they're hesitant to reach out for help because of the negative stigma. So I'd like the public to be more educated about mental illnesses such as bipolar, especially in the topic of suicide, because suicide is the second leading cause of death in adolescents. And part of the reason is that they're hesitant to reach out for help because of the negative stigma, and because they're not getting the support from their friends or family that they would like to get. So I'd like to see people more educated about the symptoms of mental illness.
Well, you're educating them right now. And now we go to step 2. We accept the fact that the person is bipolar, and it's not their fault, and they're a lovely person. So what should they be eating or drinking or doing, in your opinion?
Well, conventional treatment is taking medication.
Which one? Do you remember the name of it?
Lithium.
Lithium, yeah.
Lithium is the drug of choice, but some people, a percentage of people do respond to lithium and do really well, and they can be stable. I know of lots of people who are on lithium and doing well.
It worked for you?
No, it didn't. I'm one of the ones that it didn't work. It caused really adverse side effects for me. I was really bloated up and edematous because it's a natural element, lithium. It's a salt, but it has side effects where people can become really...
So what does work for you?
What works for me when I'm suicidal is ECT.
I don't know what that is.
That's shock treatment, electrical convulsive
Electroshock treatment,
yes.
Of course, yeah.
And I would draw an analogy between ECT and defibrillating a heart when a heart is fibrillating.
Yeah.
When somebody is in a suicidal state and nothing else is working, ECT can be very beneficial. And people can also go on maintenance ECT when they suffer with severe depression and they have difficulty tolerating the side effects of medication. That was my problem. But a large percentage of people with bipolar can take lithium and antidepressants and other mood stabilizers like anticonvulsants. There's a number of anticonvulsants that are now used to stabilize bipolar. And sometimes when they become psychotic, they have to take antipsychotic medication as well. But
I knew Dr. Hoffer in Saskatoon, you know.
Oh, did you know him?
He was an advocate, as you mentioned, for vitamin C, massive doses of vitamin C. And another thing was that now illegal drug, the one that gives you flashbacks and so forth. I can't think of the name of it. Can you?
Something that he recommended?
No, but he experimented with it in the mental hospitals. It was it's a drug that the hippies like to use, or did like to use. Very popular. Anyway, doesn't matter. What did Hoffer do for you?
Hoffer prescribed his theory, orthomolecular medicine. He believes that a percentage of people with mental illness have food sensitivities. They have allergies, and it affects their brain, just like any other part of the body. And he also recommends mega doses of vitamin C and the B vitamins and other vitamins.
And you did that?
I did that when, after having ECT and getting out of my suicidal depression. And that's when I was able to go back to school and then go back to working and I was stabilized on Dr. Hoffer's program, mega vitamin C, amino acids like L-tryptophan. They're the precursors to the brain chemicals, serotonin. And so he might have been, I don't think it's, I don't know whether they're still using it or they're finding that there's some problems with it, but L-tryptophan is the precursor to serotonin, and it helps with depression. Yes, I mean, he's a very clever man. He continued to work as a psychiatrist into his 80s, and he's now passed away. He passed away at 92. But
at 92?
He was a real advocate for people because he knew how many people would go off their medications because they could not tolerate the side effects. There's a side effect called EPS where you get all stiff and your jaw clenches and you grind your teeth, and I get that side effect and have to take side effect medications.
So what you're telling the people watching this show is that they should know about this particular problem, they should watch for it in their families, that they should be more understanding of people who have it, and then the people who do have it who are watching this show will know that there are alternative ways of attacking it. And it isn't always the right way for it. The same thing doesn't work for everybody, is what you're saying, isn't it?
Right. That's what I am saying.
But I suppose universally it would be a choice between taking pills or taking vitamin C and a good diet and so forth, eh?
Right.
What did that Margaret Trudeau recommend?
Margaret Trudeau, she's stabilized on medication, that's what I understand. She, and most conventional psychiatrists do not respect Dr. Hoffer's theories. They prescribe medication. They say medication and talk therapy. But there are some physicians who do believe in and respect Dr. Hoffer's research and theories, and they will prescribe it, but they're not going to get a lot of conventional psychiatrists are not, they don't believe in that theory.
Thank you for coming in with a very useful message.
And I thank you very much for having me, because I've been an advocate for mental illness and trying to educate the public, and I really appreciate the opportunity you've given me to come and talk, because it's not always that easy just to start talking about it. But thank you for having me.
You're welcome. And now we'll introduce the next speaker.
You're watching an independently produced community access program. The viewpoints expressed are those of the community access producer and do not reflect those of Shaw Cable Systems. The program is presented in response to CRTC policy guidelines regulating community programming.